Why are different hospitals and community services starting to introduce one-page profiles with patients? Well, different colleagues from a CCG, hospice, university and 17 acute trusts who are part of the Macmillan Value Based Standard programme came together to explore what they think the benefits are of using one-page profiles with patients. They came up with 12. 1. It shows that we value the patient as a person by learning what's important to them. There are 3 sections of a one-page profile: what people appreciate about the person, what really matters to them, and how to support them well. This shows that we see the person as a whole person and not just a diagnosis. 2. It enables us to build relationships with patients quickly, as one-page profiles help us to have different conversations. By finding out what matters to the person as an individual and not just about clinical information, it helps us learn about the person in a different way and strengthens and builds relationships. 3. We can personalise the care and support we offer to each patient. The section of a one-page profile that says what does good support look like for you directly helps us tailor the support and care we provide to the way that the person would value it most and would benefit. My care, my way. 4. Patients don't have to keep repeating information and retelling their story. A one-page profile can be available to anybody who needs that information, who is supporting the patient in a different way. A lot of hospitals are putting it either behind the person's bed or at the end of the bed, obviously with the patient's permission. 5. It helps families feel that their relatives in safe hands and that they're known as an individual. 6. It builds mutual respect between patients and health colleagues through sharing one-page profiles. A number of places are now using their colleagues' one-page profiles to introduce themselves when they're part of a patient's team. 7. It helps shared decision-making by empowering patients to talk about what really matters to them and how they want to be supported as a basis for them making decisions together about their care. 8. It prevents us from making assumptions about patients because a one-page profile helps us get to know them as individuals. 9. It's a really quick way to share important information. By having a one-page profile as part of patients' notes, it's a really quick way of getting important information about the patient, not clinical information, but about what matters to them and what good support looks like. 10. It can improve discharge planning and potentially result in a safer discharge if we're paying attention to what matters to people as we're planning important decisions like discharge. 11. It's a way to match patients to colleagues or volunteers. By knowing more about what matters to patients and who the kind of people they get on with, we can make better decisions when we have opportunities to match people. And 12, it can result in a better patient experience overall, as people are seen as individuals and therefore feel like somebody cares about them as a person. So these are some of the benefits of using one-page profiles with patients.